In his letter to the Board of Trustees, Mr. Johns Hopkins stipulates that the medical school will be part of the hospital, making Johns Hopkins a teaching hospital. At the opening of the university, its first president decrees small classes to enhance the education it provides. Pathologist William Henry Welch launches the first postgraduate medical training program in the country. William Henry Welch becomes the medical school's first dean. William Osler is the first director of the Department of Medicine and a key developer of the School of Medicine's first curriculum. Among other requirements, she sets the country's strictest admission standards and stipulates that women will be admitted on an equal basis as men. The founding 4 physicians and other faculty welcome the first class, consisting of 18 students, including 3 women, a phenomenal rarity at a time when women were barred from most medical schools. William Halsted introduces an operative course for third-year medical students, developing new surgical techniques. The first graduating class of the School of Medicine includes 14 men and 1 woman. Osler insists on teaching medical students, residents, and fellows at the bedside, which becomes one of his greatest contributions to American medical education. Harvey Cushing, a protege of William Halsted, opens the first experimental surgery lab in the nation. Procedures pioneered here would become standard practice in other medical schools. The 337-page Flexner Report cites the medical school as the exemplar of medical education, launching a nationwide reform. Founded by medical illustrator Max Bradel, it is the first of its kind in the country, providing profound insights on anatomy and operative procedures previously unavailable. Considered the mother of occupational therapy, Eleanor Clark Slagle becomes the director of the Department of Occupational Therapy. Under the direction of Adolph Meyer, the world's first psychobiologist, the clinic launches a brilliant teaching program linking psychiatry with neurology. Working in the laboratory of William Henry Howell, J. McLean discovers a substance in the liver that stops blood from coagulating, which proves vital for preventing dangerous blood clots. 32 medical seniors, physicians, and other personnel open the first university-affiliated medical unit to enter World War I. While serving in France, the 30 surviving students received their medical degrees in April 1918. The opening of a multi-million-dollar 14-building college is based on the principles of the Johns Hopkins Hospital and School of Medicine. The Wilmer Eye Institute opens the first university eye clinic to combine patient care, research, and teaching under one roof. Home of the Institute of the History of Medicine and the Department of the History of Medicine, it is the first academic department of medical history in the English-speaking world. This pioneering heart surgery gives birth to the field of cardiac surgery. A year later, Blaylock and Taussig would publish their landmark paper in JAMA. Arnold Rich publishes The Pathogenesis of Tuberculosis, establishing a foundation for understanding and treating tuberculosis. School of Medicine graduate Vernon Mountcastle revolutionizes neuroanatomy through the discovery of the column-like structure of cells in the human brain. This, along with other breakthroughs, earned Mountcastle the title of Father of Neuroscience. Victor McCusick, a 1946 graduate of the School of Medicine, founds the Division of Medical Genetics in the Department of Medicine. The life-saving technique, cardiopulmonary resuscitation, is invented by James Jude, William Cowenhoven, and Guy Knickerbocker. First intensive care unit in the U.S. is established by Peter Saffer at what is now the Johns Hopkins Bayview Medical Center. Working with collaborators at the Applied Physics Lab, Wilmer director Arnold Patz and others pioneered the use of argon laser in diabetic retinopathy, age-related macular degeneration, and glaucoma. Levi Watkins Jr. is the first African-American intern in surgery and later becomes the first Black chief resident in cardiac surgery. In 1980, he performed the world's first implantation of an automatic heart defibrillator in a patient. Mario Amzell and Roberto Poliak are the first to uncover the structure of part of an antibody's antigen-binding site, the molecule that helps the human immune system fight off infection. Paul Sponseller develops the modern surgical approach to spine problems related to Marfan's and Louis-Dietz syndromes. Pediatric geneticist and cardiologist Hal Dietz identifies a connective tissue protein as the culprit responsible for the serious and often fatal genetic disorder Marfan syndrome. Researchers discover that hemispherectomy and ketogenic diets are effective treatment for refractory epilepsy. Pediatric hematologist George Dover introduces the first effective treatment for sickle cell anemia disease pain crises, hydroxyurea. Donald Price genetically engineers a mouse model of Lou Gehrig's disease that helps to define the pathogenesis of the disease. Lloyd Minor discovers superior semicircular canal syndrome. He would go on to develop a canal plugging surgery to treat it. Peter Pronovost creates a simple 5-item checklist protocol that greatly reduces infections when inserting a central venous catheter and launches his work in the prevention of patient-related harms. Robert Montgomery lays out the blueprint for first 5-way donor kidney swap among 10 individuals, pairing altruistic donors and incompatible recipient pairs. The new Genes to Society curriculum courses focus on, among other things, how each organ system is affected by genetic inheritance, biology, social and cultural factors. Jeanette Okoye and Sewon Kung create the Ethnic Skin Program to care for and research dermatologic conditions that preferentially affect patients with darker skin pigmentation. A surgical team led by Andy Lee treats wounded warrior using an innovative treatment to prevent rejection of the new limbs. The proteome becomes a resource for scientists in every biomedical field. Hopkins researchers contribute to a breakthrough study linking Zika virus and microcephaly. Foundational work for harnessing immune responses to fight cancer by Drew Pardall and Hopkins colleagues leads to the formation of the Bloomberg Kimmel Institute for Cancer Immunotherapy. For 125 years, contributions, great and small, have propelled us to where we are now, and new milestones are being created every day. Congratulations, Johns Hopkins School of Medicine, where tradition meets innovation.